Today we're going to talk about skin cancer. And we covered in a previous episode, and you can subscribe on iTunes, just look for Ask Dr. Tom. But we just talked about melanoma last week, which is a form of skin cancer. But this is the umbrella of skin cancer. So, Dr. Tom, what exactly is, for people that don't know, never experienced it, and don't have any expertise in this area, what is skin cancer?
So basic definition of skin cancer would be the abnormal growth of skin cells. As you kind of mentioned a little bit, there's different types of skin cancers, and I guess we'll go over some of them a little bit later. But some things maybe to know about in skin cancer from a general perspective is that there seems to be a direct relationship to cancers of the skin and sunlight or sun tanning. So like use of even tanning beds and things along those lines. So it's important for people to know because this is all stuff that is preventable. So, unlike a lot of other cancers where sometimes things happen, like how this happened to me, this particular cancer, one of the biggest risks is exposure to ultraviolet light, whether it's natural or synthetic. So just by people being aware of it and then limiting their exposure, that could really change things, reduce the risk dramatically.
Dr. Tom is Dr. Thomas Incledon. He is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. That's where he is now. And today's topic is skin cancer. What are the different types of skin cancer that people could come across?
So there basically is three main categories or types. One is squamous cell cancer or squamous cell carcinoma. It's basically there are cells located in the epidermis. That's the outer layer of the skin. These cells are kind of like flat. They look like fish scales if you're going to put a description to them. And so that's how they get their name squamous. And basically, if there's a cancer in that type of cell, it would be called squamous cell skin cancer or squamous cell carcinoma. In the lower part of the outer layer of the skin, there are special cells called basal cells. So if there's a problem with those cells where they become cancerous, then you would have a basal cell cancer. And then you have melanocytes, which are the cells that produce the pigment in the skin that give you that tan look, or if it makes you darker skin if you're born with more melanocytes. And so then if there's cancer in those cells, you get a melanoma. And so basically you have basal cell carcinoma, squamous cell carcinoma, and melanoma are the three main skin cancers.
So where in the body does the skin cancer typically start?
So if it's from sun exposure, it'll be any surface area that gets direct sunlight. So you're thinking about like the scalp, your face, maybe your arms, things like areas that get the most amount of direct sunlight. So you could say from a simple perspective, any area that gets hit directly with sun. There is, there's also people can get skin cancer in areas that don't receive any sunlight. So that raises a concern like, well, how did that happen if most people seem to be getting cancer from sun exposure? How are these other people getting cancer that don't even get sun exposure? So that points to that there's got to be something else going on. One point that should be made is that it doesn't matter how dark your skin is. Everyone is at risk for skin cancer. Sometimes people think that because they have darker skin or they come from a hotter climate, that there may automatically be some protection. While cancers of the skin are higher in people that are fair skinned, they can occur in anyone. So I want to make sure people don't leave thinking, oh, I'm protected somehow. It's possible anyone can get skin cancer.
We're talking with Dr. Tom. This is Ask Dr. Tom, and you can subscribe. In fact, if you have a question for Dr. Tom for other episodes, we tape these, usually a handful of them at a time, and broadcast live while we're taping them. But you can get your question in at askdrtom.com. Spell out the word doctor, askdrtom.com. Dr. Tom, you mentioned the three types of skin cancer. I know that you're going to recap and talk about what they are. The one that starts with the B, the one that starts with an S, and the one that starts with the M. Do each of those types of skin cancer have different symptoms, and do they differ?
Yes. I was going to see if you got to be like, wait, where's the rest of it? So there are differences between the different types of cancers and or skin cancers. So first, on a basal cell carcinomas, so that was the B cancer. It usually occurs in the areas of the body that are exposed to sun. And some of the symptoms, if someone has it, how would they know if they have basal cell cancer? They'll see some bumps that may have a pearly or waxy look or appearance to them. They may have brown or like lesions or scars that are on their body. Sometimes they could be flat, or sometimes they could be flesh colored. There could be bleeding or scabbing sores that heal, and then they seem to reoccur again, even though maybe there was no scratching or scraping of the skin. So those are some of the symptoms of basal cell. Now, in contrast, squamous cell also can occur on the areas of the body that have sunlight, but it's people that have darker skin are more likely to develop that type of cancer in areas that don't get any sunlight at all. And then in terms of the symptoms, like what would it look like when you have squamous cell cancer or squamous cell carcinoma, they look like red nodules. Sometimes they could be a flat lesion with a scaly or crusted surface. And then for melanoma, melanoma can occur anywhere in the body where there's normal skin or where there's moles. And typically, melanomas often appear on the face or trunk, more in men than women. And it seems to affect people regardless of skin tone. And it doesn't seem to matter if there's sunlight or no sunlight. It seems to occur equally in both areas, exposed to sun and not exposed to sun. And typically, some of the signs of a melanoma would be a large brownish spot with speckles. You might see a mole that suddenly changes color on the body. And there could be dark lesions anywhere in the body, hands, the toes, any mucous membranes at the mouth or the nose. It could even be at openings of the mouth, like the vagina or the opening to the rectum. So there's definitely some differences between the different types of cancer, skin cancers.
When would you go to see a doctor? How would you know if it's appropriate to go and see somebody? And at that point, what kind of doctor do you even go to in the beginning?
So that's a really good question, because what typically happens is people blow it off. And normally, remember what I was saying earlier, that it's more likely to occur in men than women. And guys usually push things off more than women do.
Yeah.
So real simple answer. If you see any abnormal skin changes, just go to a doctor. And the reason is it's better to go to the doctor and they say, hey, everything's fine, there's nothing there, versus you push it off. And now you've got something really serious that could, affect your life or the quality of your life for the rest of your life. To me, it's just a bad investment of your own time and money to push things off. Excuse me. So now, as far as the type of doctor, so usually what I see is someone sees a primary care physician, maybe they're getting a routine checkup. The primary care doc says, hey, look, I'm seeing something here. I don't like the way it looks. I'm going to refer you to a dermatologist. And then depending upon the background of that dermatologist, they might say, hey, you got something going on. I'm going to run some further tests. Or, hey, I could do a simple treatment to, address this. But then depending on how advanced the cancer is, based on, the test results coming back, the dermatologist may refer you to an oncologist, and they may collaborate and say, all right, here's how we're going to treat this cancer and get it out of this person's body. I will say, though, in terms of what I've seen, across the board, I've actually seen people go and meet a plastic surgeon, and they said, hey, look, take a look at this, mole on my head that's changing color. And a plastic surgeon say, oh, yeah, I've seen this before. It's definitely something we should remove. And then, 5 minutes, the thing's removed. I've actually had some moles that I didn't like the way they looked. I saw a buddy of mine as a plastic surgeon, removed them, and never had any issues afterwards. So in terms of the excision part, let's say removing like a small piece, lots of doctors have the surgical skill to do that. Whether or not there's any additional work really depends on what are the lab tests and the imaging, what does that show?
So we're talking with Dr. Tom. I'm jumping ahead here because now I'm thinking of other questions. We're talking with Dr. Tom. It's the Ask Dr. Tom show. And Dr. Tom is Thomas Incledon. He's the founder and CEO of Cause Into Wellness. and the Cosenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making Dr. Thomas Incledon one of the most sought-after healthcare professionals of our time. If you'd like to find out about working with the team at Cosenta and Dr. Tom, wherever you are in the country and the world, the details for setting up a free consultation and a call are at causenta.com. That's CAUSENTA.com, causenta.com, or you can phone directly 480-883-7240. I'll give you that number again, 480-883-7240. So we're talking about skin cancer today. And we just talked about like when you should go see a doctor and what kind of doctor you might want to see. Why would you want to make sure that you don't blow this off? Dr. Tom, you're telling us that guys are typically more likely to have this happen, or it's happening more often to guys. They're the ones most likely to blow it off. What are some of the risk factors associated with skin cancer? So you go like, yeah, here, don't blow this off for too long here, people.
Sure. So, in terms of the primary risk factor, ultraviolet light exposure, and that's mostly direct sunlight, and then would be the use of tanning beds. Now, there's been, different types of studies looking at maybe changing the wavelength of the ultraviolet light in order to minimize the risk of cancer. But just collectively, we would still say sun and tanning beds would be your two primary risk factors. Outside of that, there's a pretty good laundry list of areas. I'm just going to read off a few. So fair skin, so basically people with lighter skin at greater risk. Anyone has a history of sunburns, anyone that has been getting excessive sun exposure, anyone that's living in sunny or high altitude climates. One of the things that a lot of people sometimes don't realize is, like in the wintertime, people tend to be covered up a little bit more because it's colder. So you may not think about the fact that you're still getting exposed to ultraviolet light from the sun because it's not as sunny out, if you will. The ultraviolet light does appear to go through clouds. And so even when it's not as sunny, there's still some potential risk there. Anyone with moles, anyone with precancerous skin lesions, anyone with a family history of skin cancer, anyone with a personal history of skin cancer, anyone with a weakened immune system, and then things like exposure radiation, exposure to certain substances. From all these products that have been used in different industries, we now know that some products do appear to irritate the skin or increase the likelihood of skin cancer. So there's definitely things that can increase risk. A lot of this, though, is if you notice, there's a common element of sun exposure, and all it takes is people to be prepared, and that could dramatically reduce the risk for skin cancers.
Yeah, my next question is skin cancer preventable? It sounds like in some ways it is.
It definitely is, and I guess what I would say is this. I hear a lot of times people say, well, if I have cancer, I don't want to know, or if there's something wrong. I actually got a text this morning from a guy, and he had some pain, and he went to see, he contacted us, and I said, all right, we'll schedule to come in. Would you like a list of tests to get done by your docs back home? That way, when you come here, we're that much further ahead. He goes, sure. So he goes, and he gave him a bunch of tests to get done. And these are tests that I would say are basic. Any doctor could do them. It just turns out most doctors don't do it unless the patient says, hey, I want you to do it.
Right.
So he gets these tests done, and he gets some markers that are super high. So he's texting me. He's like, I'm on the internet, and it says I could possibly have cancer and this and that. And I said, look, man, one, I can't diagnose you from a text message. I can't help you with any of this stuff. I got to actually see the results. After I see the results, we'll sit down and discuss them. But here's what I want you to know. It's always better to know facts and take action from the facts than not know anything. And his perspective was kind of like, well, if it's cancer, I don't want to know. I'm like, well, how are you going to solve the problem if you ignore it? It just never gets better. So I sent him then some different blog posts and stuff we did in the past and some podcasts just to kind of put his mind at ease. Like, look, no matter what it is, it's better that we do something than do nothing. And not only that, I'm pretty confident I'm going to be able to help you. So either way, it's going to be, I think, a win in the end. Now, in terms of how do you prevent skin cancer, simplest thing is just avoid direct sun exposure when the sun is at the highest point in the sky. So in North America, you might say, between 12 and 4 o'clock. The exact time, where you are in the U.S. may vary a little bit, but you just minimize being outdoors during that time. If you have to be outdoors during that time, just make sure you have really good protection against the sun. So it would mean like, sun blocking creams or lotions or something that have an SPF of 30 or higher. Maybe covering yourself with something to prevent the sun from exposing to the skin. And then just minimizing sun, it would go a huge step in the right direction. As far as other stuff, just getting regular checkups. This is a common theme of a lot of our podcasts, is that stay on top of your own health with your docs. And then from time to time, maybe just look and see, you could Google things like, what should you expect during a medical exam? Like your doctor, whoever your primary care doc, during a physical, they should be looking at your fingers and your toes. They should be looking at around your body, because you need a medical professional that says, hey, I found something that you don't normally have. And then if you're someone that has a partner in life, your partner should be looking at your body as well. And that's one way you could have, you and your partner could be helping each other. Like, hey, there's this mole that's changing color. It wasn't like this before. And that way people will take action sooner and then dramatically reduce chances of problems later on.
You mentioned putting on lotion like sunscreen and things like that. Should we be paying attention? I've seen articles that come across, and especially in today's world, like social media and stuff, where it's like, oh, this, skin cancer is caused by this, and skin cancer is caused by that, and there's chemicals in the lotion, and your skin is this huge organ; it's the biggest organ we have. So, should we be watching? Are there things we should be looking out for that we don't want to put on our skin that maybe we're overlooking?
Yeah, so it's possible that there's a number of websites that are now dedicated to chemicals in common products, like whether it's shampoo, toothpaste, deodorants, lotions of all kinds, not just like sun-blocking lotions, but other kinds too. And you could look and see, have any of these chemicals been linked to different types of cancers or other types of issues. The one challenge I'll say, though, is that, if you look hard enough, almost everything you see that's synthetic probably has some data behind it at some point that it could be damaging to the skin. So then it gets into a thing like context. And is it serious enough from prior studies that people should avoid it? So if that were the case, then a simpler solution would be just don't go outdoors during those times, during 12 to 4, and dramatically reduce it. So in our office, Dr. Anderson is kind of who usually looks at all those details, like chemicals and stuff, when she sits down with patients and goes over those things. So there's solutions that could make it, let's say, more practical. Like one, if you're concerned about the chemical, there's some online references that people can use to get a list of like how, is it a serious threat or not? Mm-hmm. And then outside of the online references, if you're like, look, man, I don't want to spend all this time looking into everything. I got too many other things going on in my life. I would say, well, then just simply avoid it. And in that way, in other words, if you're not out there 12 to 4 or times when there's peak, when the sun's at the highest point in the sky, now you're minimizing your exposure in a way that could be damaging to your skin.
How is skin cancer diagnosed?
So there's a number of ways it's diagnosed, but starting from the simple to maybe the more detailed, just through a physical exam. Any dermatologist, most family med docs, like every doctor during med school has training on basic things, like how to do a physical, how to do an assessment, things like that of the body. So depending on who you first see, like some people may see something on their own and may go right to a dermatologist. Other people may go to a family practice doctor first, or whoever their normal doc is, and go from there. The doc could look at it, and then typically what they might say is, hey, there's something here. We're going to do a biopsy. So we're going to take a piece of that skin tissue and send it out to a lab. The lab's going to take a look at it, and they'll run what they call a pathology report and tell you the type of cells that are there, and if those cells are consistent with a type of skin cancer, like the basal cell carcinoma, squamous cell carcinoma, or melanoma. And then, depending upon how it appears, the doctor may also order some imaging tests. Imaging tests would just basically look and see, has this cancer spread anywhere else in the body? And then the doctors may offer staging of the cancer, and the significance of knowing where the cancer is and the staging is important, because then that helps you to determine like the best types of treatments later on.
We're talking with Dr. Thomas Incledon from the Cosenta Cancer Treatment Center in Scottsdale, Arizona, and today's topic on the Ask Dr. Tom show is skin cancer. It's a good time to start thinking about this because the weather's getting nice, people are getting outside, and I'm learning already, it really even also doesn't matter if the weather is that nice or not. I mean, if you're in the sun and you're in the sun during those prime hours, you got to be paying attention to this. So what are the latest technologies then available to treat, if any? I don't know, if there's something that's new stuff is constantly coming out for, new technologies available that would treat skin cancer, if any?
Yeah, see, there are. So on the one hand, you have like brand new technologies that maybe have never been done before. But then even within existing technologies, there's newer medical devices that make the procedure simpler, faster, more accurate, things like that. So just kind of giving people sort of like a list of different options. One is freezing or cryosurgery. Basically, you just freeze the cancer cells off the body. You have various types of surgeries where a surgeon could just simply use a scalpel and remove the skin cancer. You have other types of techniques that, depending on the type of cancer, so things like radiation, chemotherapy. Now, a lot of times people seem to have this bias that, radiation is bad and chemo is bad. But what I always ask people is, one, to keep an open mind and find out how much radiation and, where is it being applied, and what type of chemotherapy drug, because sometimes the solution could be very quick and inexpensive to someone if they take action fast enough. But if they're so fear-based in their thinking and they wait and delay making a decision on the treatment, then they run the risk that the cancer is continuing to spread and get more around the body. And then some areas that I would say a little bit newer that most people are not aware of is, one is photodynamic therapy, or another term sometimes used is either photobiomodulation. It's basically the use of different wavelengths of light with some substances that people ingest, or sometimes they could rub on the skin, and the interaction of the light with those substances basically kills cancer cells. In some cases, it can work really fast. I've seen a number of skin cancers that people come in and we do some cocktails that we rub on the skin. They give them a few pills they take, and then they do like a light outside where the cancer is, and it just disappears, over days. And then most people are like, wow, I didn't even know. You don't feel anything. So it's kind of hard to imagine something so powerful that you can't even feel, And then also recently there's some biological-based therapies, and those biological-based therapies can involve taking substances that stimulate your own immune cells to kind of find a cancer and kill it, or they may incorporate taking parts of your cancer and then repackaging it and introducing it to your immune system in a way that it could do a better job of finding the cancer and killing it off.
We're talking with Dr. Tom. The Ask Dr. Tom show is available on iTunes, and you can subscribe to it. I'd recommend doing that because people talk about a cure for cancer. They talk about, all the money that's raised for cancer and how we just need to raise more money or more awareness. And then, Dr. Tom talks with patients and discovers that people really aren't that aware of a lot of the details about, like, the simplest thing, like get seen soon, get early detection, that sort of thing. So this is why, you have a doctor here sitting in a studio talking to people on social media and on the radio and anywhere possible, is to get in front of as many people possible to remind you that you should go and get checkups and you should get detected early. I saw on Dr. Tom's Facebook page that a lot of people watch Shark Tank, and Damon John, one of the guys from Shark Tank, he was the guy that started the FUBU clothing line. He shared last week on Good Friday his story of, and I didn't know that it was a cancer story until I saw it on your Facebook page, but he was showing his neck, and he's got a tattoo on his neck that you never see because he's always wearing something that covers it. But he's got a scar there from where he had his thyroid removed. And he was diagnosed with cancer in his thyroid on a Good Friday in 2017. And now he's telling everybody, get tested for anything and make sure that you're on top of all of it because this changed my life and I had no idea. And he's out there telling people. That's what Dr. Tom is sitting here doing. And the reason why he's doing it is so that no matter where you are in a place where you go like, okay, well, this has been bothering me, or I got this itch here, or I got this symptom there. I better go get it checked out because you can't get treated and you can't cure anything if you don't know that you have it in the first darn place. So share this with your family, whether it's on Facebook or YouTube or on social media, or you're getting it on iTunes or you're hearing it on the radio. Go to AskDrTom.com and share it with your family members. And so, whether it's skin cancer or other cancers, there's an episode for each one of these terrible killers that we're going through one by one. Today's is skin cancer. And I wanted to ask you, so how does Causenta, that's your place in Scottsdale, Arizona, where anyone can go. How does Causenta, you and the team at Causenta, treat cancer, skin cancer specifically, using natural methods, if at all? Is that even possible?
Yeah, it is. So, part of our commitment to each and every person who walks through the building is, hey, we're going to do whatever it takes to help you. So before you walk to the building, I don't have like a magic recipe book with your name on it. Like, I actually have to learn about what's going on in your body, understand you. Is there anything unique we need to know? Like, do you have another medical condition, right, that may impact the decision-making for the best course of treatment for your body? But let's just say, hey, there's like nothing else going on, and it's just like skin cancer, and let's just say that it's spreading. So a simple strategy would be something like this, where we'd say, okay, the fastest way to remove the cancer would be surgery, generally speaking. So you got, some growth on your skin. The logical thing would just be get it cut out or frozen off or something like that. So now it's gone. But one of the concerns then is, what about any cells from that little tumor or that piece of cancer? And, what if there's something going on in the body? How do we know there's not something else in the body that's still damaging DNA, so that you'll wind up getting skin cancer again later, but just in a different part of your body? And so, in order to address those concerns a lot of people have, is we look at all the medical records, we see what tests have had done, and then we say, all right, here's some additional tests that may provide some insight. And we find out, does their insurance cover the testing? Does insurance not cover the testing? Help them get the best value for their money there. And let's just say, for argument's sake, someone never had any vitamin mineral testing, would recommend that, because then if they have something they're low in and they don't know anything about it, it's never going to be addressed. So the risk for future damage is still pretty high. And we want to take the opportunity that, like, while you're treating or dealing with cancer now, let's make sure we do enough good things that you never have cancer again. And so we'll run some tests, find out what's missing and what's needed, and then we'll create a customized plan for that person that will make them feel they'll have a lot more energy. We'll teach them how to exercise, how to move, do some different therapies, maybe for other parts of their body, and just help them to get into a much healthier lifestyle. And then typically what we see is people just don't get cancer again, because they've made all these improvements in their lifestyle that it's unlikely that they will get cancer again. But then we also set up monitoring systems to make sure that there's nothing going on that they didn't know about. And if there is, then we take immediate and decisive action to address those issues that we uncover.
This episode I'm calling it the skin cancer episode. It's a very generic term for the three different kinds of skin cancer that you mentioned. One of the things that we didn't necessarily cover, and I'm wondering about, is does skin cancer, we've heard about some of these cancers that kind of spread pretty quickly. It seems to me that maybe people don't take skin cancer as seriously because it seems like does it spread quickly or slowly or differently than other cancers? So
maybe at the beginning it could be slow. So what happens a lot of times, people push things off, right?
Yeah.
And now let's just say, let's use some simple math. Let's say I have 10 cells on my skin. That's going to take a while for that to grow and really have a threat to my life, you know? But because now people push things off for so long, now by the time they get something done, it's not 10 cells, now it's like 100 million cells or something much greater. And then what tends to happen is a lot of other things start coming into play. So generally speaking, it's not as big a concern as some other cancers because one, it's the most common type of cancer, one of the most common types of cancers. Two, it's treatable, so you don't hear a lot of people dying of skin cancer. However, it doesn't mean you don't suffer. And I think sometimes what happens is people hear about like one cancer, it's deadly, and they hear about another cancer, maybe not as deadly or not as immediate a threat, and they kind of like, belittle its impact, but they're not considering, well, you get to a point where now maybe your joints all ache, or you have to take all these other drugs, and now your quality of life is so impacted. Now you're urinating and defecating all over yourself. So, hey, you're alive, but so you're not dying from the cancer, but you're not happy with the way your life is going at that point. And so, the way I approach it with anyone is I don't care if it's stage, 1, 2, 3, 4. Let's do something about it now. And the idea is if it's stage 4, it's going to literally save your life. If it's stage 1, 2, or 3, you may not be in that situation where it's life-threatening yet, but we want to keep you from ever getting there and keep you from wasting all kinds of money on stuff that, makes no sense. It's kind of like, you ever watch someone spend a lot of money, lose weight, and then they get in shape, and now they go right back to doing the same things they did. So now they gain weight again, and they just keep paying over and over again for the same weight loss. And that's sort of like what people do with dealing with cancer, because they make all this progress and they go right back to a lifestyle or environment that's going to make it easy for the cancer to grow again. And you wonder, why would you want to do that? It's one thing, if you just talk about a few pounds of body fat, that's one thing. If we talk about cancer, it's a whole another level of, you just don't want to do that to yourself. And hopefully after people hear some of these podcasts, it gets them thinking in a newer direction and maybe taking action a little bit faster.
So the action that you can take right now is take a moment to go to causenta.com, CAUSENTA.com. Go there. If you or someone you love has been diagnosed with any form of cancer, there's a form to set up a call. It's a free consultation. See what and how Causenta can create a plan that is customized for you and your particular diagnosis. Causenta.com, CAUSENTA.com. Or you can phone area code 480-883-7240. The number again is area code 480-883-7240. That wraps the skin cancer episode of Ask Dr. Tom. We're going to do another episode. So what we do is we tape these and we broadcast the taping live. So if you're on Facebook or you're on YouTube or you're on Twitter and you're seeing this or somebody sharing it with you, we record them all, and you can listen to them one by one as you like, anywhere podcasts are available or on iTunes. And so we're going to move on to a new episode. And this, I'm going to ask you again, to pronounce it, and then I'll ask you the question just to make sure I get it right. How do you pronounce it?
Squamous cell.
Squamous cell. Okay.
Yep.
So what exactly is squamous cell cancer?
So squamous cell cancer is just basically cancer of specialized cells that are referred to as squamous cells. These are like flat, scaly cells. Some people say look like fish scales, if they were examining them under a microscope or something. The one thing I'll say, though, is that it's usually thought of as skin cancer, but squamous cells they're in layers of the skin all over the entire body. So you could have actually different types of squamous cancers, like in the mouth, and let's say, and then in the skin and other parts of the body. This is generally considered like a slow-growing cancer, so that part would be good. However, if it's not addressed, you could have this stuff all over your body, and it's all discolored.
Oh.
marks and lesions everywhere. So it's pretty unsightly. And then, you run the risk, well, what else is going on? As an example, we have a case right now where someone's got, with squamous cell cancers for years. I'll be meeting with them later today, first time, and going over the history with this person. What's interesting is they've tried all kinds of treatments, and it may take it, they may have a surgical procedure, removes that spot, but then it comes back. They've tried different therapies, but what's happened over time is they're now getting other skin conditions. Not only do they have cancer of the skin, they have rashes, and they have infections with bacteria and fungi. And so, so even this is kind of like what we were talking about earlier. While this may be a slow-growing cancer, it doesn't mean don't do anything, because if something's not working or you're not taking decisive action to eliminate it, you're going to wind up with other complications on top of the cancer, which would just, make life hell.
We're talking with Dr. Tom. This is the Ask Dr. Tom show. Dr. Thomas Incledon is the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. And today's topic of this episode of Ask Dr. Tom is squamous cell cancer. So you mentioned a couple of spots, but where exactly is the squamous cells, where are they located in the body?
So so technically you would say they're located in the epidermis, which is the outer layer of the skin. But a lot of times when we think of skin, we think of our forearms, right? Or we think of our thighs or something. We don't think about the lining of everything on the outside of our body. So even like in our mouth, all the way through, so the opening of the mouth, opening of the rectum, there's squamous cells at those openings in either part of the digestive tract. And so if we kind of then say, all right, well, where are squamous cells located throughout the body? You have the mouth, you have the lips, you have the cervix. You also have areas like the respiratory tract and different parts of the digestive tracts. In other words, where you're breathing and stuff. And then you have linings of the hollow organs of the body. So essentially, that's a lot of surface area that there are squamous cells located, and there's potential for cancer in any of those areas.
And how is squamous cell skin cancer then different from the other skin cancers that you mentioned, or that in general? I know there's three different ones. Yeah.
Yeah. So basically, there's three different skin cancers. You have squamous cell, you have your basal cell, and then you have your melanocytes. And essentially, the differences in the cancers is that because they're different cell types, when there's cancer in any one of those cell types, it produces a different type of skin cancer. And there's certain, sort of characteristics associated with each cancer. There may be some differences in risk factors, but also in how they respond to treatment. And so depending upon the type of skin cancer, then that would determine the direction someone goes with their physician for treatment.
We're talking about squamous cell cancer with Dr. Tom. This is the Ask Dr. Tom show. Dr. Thomas Incledon is the founder and CEO of the Causenta Cancer Treatment Center in Scottsdale, Arizona. And in order to, if you or somebody you love has been diagnosed with this form of cancer or any form of cancer, and you'd like to explore what having a specific customized plan looks like for you and your specific diagnosis or your family member's specific diagnosis, the next thing you can do is go to causenta.com. That's their website, causenta.com, causenta.com. And if you scroll down on the front page there's a way for you to set up a free call. And you can do that very quickly and have a nice consultation with somebody at Causenta, or you can call directly at area code 480-883-7240, 480-883-7240, and find out what it looks like when you talk to a team with cutting-edge technology and a mindset of setting up a plan for what is specifically going on in your body with all of the unique circumstances that happen in your particular body. Nothing off the shelf. So it's a unique experience and one I recommend for everybody. And that's how you can get started. But we're talking about squamous cell cancer. It's a form of skin cancer. What you mentioned some of the risk factors. So what are the risk factors for this particular carcinoma?
Sure. Just a quick list here. We got older age, male, men, yeah, people with fair skin, blue, green, or gray eyes, blonde or red hair, people that spend more time outside because of the increased exposure to the sun's ultraviolet rays, long-term exposure to chemicals such as arsenic in the water, different types of diseases that weaken the immune system, so things like HIV, AIDS, HPV. So, anything that could really challenge or weaken the immune system increases your risk. And then exposure to radiation, and then inheriting like a genetic condition. So an example, if multiple members of your family prior to you had skin cancer, and now, you come into the picture, you may have gotten some of the genes from your mom and dad for skin cancer or the squamous cell cancer.
And for all the people that are scouring their bodies and looking at their arms and their neck and everything else, wherever they can now, going like, oh man, do I have something going on? What are the symptoms they should be looking for squamous cell cancer?
So the way that the cancer will look, like if you're looking over, at your bodies, you might see like a firm red nodule. Sometimes it could be a flat lesion with like a scaly crusted surface. Generally speaking, you're more likely to find it on the areas of your body that get the most sun exposure. So classic example would be like guys are going bald, they don't wear a cap, and they get something on the top of their head because they don't think about protecting that from sunlight. Recently, another one came across my attention that I honestly have to say I didn't think about is I'm seeing so I see lots of people wear sunglasses, but sometimes I see people like in sunny environments, I see some people say, oh, the sunglasses bother my eyes. So they don't wear any protection for their eyes. And so indirectly, their eyes are getting a lot of direct sunlight because, it's not like you put cream on your eyeballs, you know what I mean? So you kind of have like this surface area of your body that is more susceptible to DNA damage from the ultraviolet light. So it kind of, it argues for more people to wear eye protection as well.
How is squamous cell cancer diagnosed?
So essentially, the sort of the strategy would be you see a doctor. The doctor looks at your skin. Most of the time, usually a person finds it themselves with just a bump, and they go to the doctor and say, hey, I got this thing that's changing color on me. Sometimes it could be, your partner says, hey, there's something on your back that, I haven't seen before. It's getting bigger or changing color. And then once you see the doc, they might do a biopsy. They might do then a follow-up of some other types of testing, some imaging testing or some blood testing. And then they'll take that information and use it to stage the type, where the cancer is. And that becomes important later on for knowing what type of treatment to take.
We're talking with Dr. Tom. This is the Ask Dr. Tom show, and Dr. Tom is Thomas Incledon. He's the founder and CEO of Causenta Wellness in Scottsdale, Arizona, and the Causenta Cancer Treatment Center there. If you're seeing this on social media or listening to this on your own devices, on iTunes and things, you please share this with somebody in your family, whether they have a skin cancer diagnosis or not. There's a whole series we've been doing where we go through each of these, the most serious cancers that Dr. Tom ends up treating and the team at Causenta end up treating. And the whole mission here is to give you a real sense of how it works and why you should take it seriously, but not be overly scared and frightened about actually getting a diagnosis and taking the bull by the horns. Some people just want to ignore things and put their head in the sand, and that is not going to serve you at all. So Dr. Tom's mission here is to get this information out to as many people as possible, and the only way to do that is with your help. So thank you for sharing and spreading that message with us. Today we're talking about squamous cell cancer. It's a form of skin cancer. What are the latest technologies available to treat this form of skin cancer, or any for that matter?
So we've got things like freezing the cancer off. So sometimes that's referred to as like cryosurgery. Got various types of surgeries where the physically doctor uses like a scalpel to kind of cut it out, if you will. Then you have different other, let's say, surgical procedures using electricity. So they may refer to it as like an electrode dissection or sometimes a electrotherapy or cryotherapy. Then you got some other options that things involve radiation or chemotherapy. And so those would be kind of like more the strategies that people might hear about or read about or something, or the doctors might talk to them about. And then some of the more, let's say, recent strategies would involve things like using different light or lasers combined with different substances that people take. Those substances could be natural or synthetic or sometimes both. And the idea is getting something into the cancer cell so when light hits it, the light blows up the cancer cell, almost like a Trojan horse, like you sneak something in the cell and it goes off like a grenade on the inside. And a lot of people seem to like that approach because you don't feel anything at all. Like you honestly don't even know anything's happening. And, then you just see stuff shrink away. But that's not always, there's some limitations on how deep the light can go into the body and where it could reach. And so it may not always be a good fit for different types of cancer, skin cancers. And then the biological therapy was one where basically people are taking either by injection, sometimes by mouth, different substances that stimulate your immune system to do a better job of fighting the squamous cell cancer.
The topic today is squamous cell cancer. It's a form of skin cancer, and we're talking with Dr. Tom on the Ask Dr. Tom show. You can get a question in at askdrtom.com. Spell out the word doctor, askdrtom.com. Could be about this form of cancer, any form of cancer, anything you'd like us to talk about on future episodes that people can listen to at iTunes and anywhere podcasts are downloadable. So we're talking about squamous cell cancer today. How does Causenta treat squamous cell cancer naturally? If that's even possible.
Yeah, so this particular type of cancer is it's very possible to treat naturally. We actually have a number of cases now that we have treated successfully without any chemotherapy or radiation or surgery. It's a combination of supplements and some medications that are simple. There's minimal side effects. They report in the literature, and in the case of our experience so far, 0 side effects any patient has reported. And we got really good PET scan, CT scan type imaging showing reduction of the cancer burden in the body over time. And patients have gotten stronger and faster while they're going through cancer treatment. So it's kind of a pretty cool finding. I don't know that many places that could say, hey, this patient came in weak and frail and cancer all over their body, and now we did something and they're running around with more energy than ever before, and there's less cancer in their body.
This is kind of a double question here. Mm-hmm. Next one is, what are the options of treating squamous cell naturally? I think we just kind of covered that. Do you want me to ask you that again, or should we?
Well, yeah, I think the idea maybe is so a lot of times people will come in and they'll say, I'm doing this treatment. And they actually state it in a way like it's accepted that one therapy is 100% successful at treating their cancer. And we already know there is no therapy ever discovered that's 100% successful for all cancers. But now even within specific cancers, it doesn't work like that. And the reason is, as people have cancer, that cancer can mutate and change over time. So that's why you start with a treatment, and it may not work, and you have to add other things to it. And what we've uncovered an exact ratio of different substances that we combine them and use them. That it works really well, but it's not like you just walk in the door and I got this recipe in a bottle that I could give you. The way it sort of comes to pass is we're testing you, we're monitoring you, and we try one thing. And let's just say that one thing didn't work. Now we add a second thing, and a third thing, and a fourth thing, and we keep modifying the approach or the protocol until we get a result. And so something that is more realistic that most people don't understand is that you might fail 5 times. And what I mean by fail, you tried something, it didn't work. You tried a second thing, it didn't work. You tried a third thing. So now you got 5 things, didn't work. And all of a sudden now we add one more ingredient, and all of a sudden we're getting 70 to 80% reduction in cancer in the body. The way we're able to do that is because our oncologists and our rest of our medical team they're on top of monitoring the patient. So that's where we can evaluate, is it working? Is it not working? And if it isn't working, how do we make the result better? When I look at when people come in, they'll tell me, oh, it was working, but then it stopped. I'm like, okay, show me your data. They never have any data. Their definition of working is they felt more energy. Well, how you feel and how much cancer is in your body are not connected. So you may feel amazing and the cancer could still be growing. Mm-hmm. And so most people don't have the medical expertise to provide the objective details they need to make the right decisions. So what tends to happen is they make all these poor decisions, or maybe wrong decisions, depending on how you're looking at it, that are ultimately going to affect their life, but they just don't know it because they feel good. And so, what we're able to do here is actually use objective measures to verify that something is working. And our focus is we use a lot of natural substances simply because we have data that it works and it's less threatening to health. It's more affordable later on for people if they need to continue treatment once they leave the center. So it's a better strategy overall.
So the thing to do now that you're aware and now that you're sharing, I mean, if you don't know anybody with a diagnosis and you're listening to this this episode of Ask Dr. Tom, you could just simply share this and other episodes with people that you know and love and are connected with on social media. If you know somebody or somebody in your family or yourself has been diagnosed with any form of cancer and you're looking for something more personalized, something that's not off the shelf, something that's designed around your cancer, your body, the thing that you can do right now that's easy and free is go to causenta.com, CAUSENTA.com, and right in the middle of the front page there's a way for you to set up a free call, totally free, and that is your opportunity to get in contact with the team at Causenta and find out what a personalized option looks like for you. You can also do it by phone by calling 480-883-7240, area code 480-883-7240 if you prefer to use the phone. And for something like this, you may. The beauty of this is you don't have to jump on a plane right now and go to Scottsdale, Arizona and get to Causenta in person. You always have that option to do it, but you set up a call either at the website or on the phone and find out if it's something that you want to investigate further. It's that simple. That sort of sums up the squamous cell cancer episode of Ask Dr. Tom. Is there anything else that you want to add about this particular cancer before we put a pin in this episode?
Just that this is one of our favorite cancers to actually treat, and the reason why I say that word is that we could usually help people very quickly and very inexpensively with this type of cancer, and compared to the more traditional routes of treatment, we offer so much better that I strongly encourage people that have any form of squamous cell cancers. Just, give us a call, do the free consult, because our results are, I think, the best in the world from anything I've seen so far.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms, and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.